Today's topic is going to be about problems as a result of immobility or limited mobility that patients might experience. Hi, I'm Kathy Getrust, and I'm an instructor in community health. The importance of activity has been well known for a long time, but there has been such an increase in focus on the importance of exercise and activity in our society in the last few years. Newspapers, magazines, and books address the issue. Exercise videos and programs are everywhere. Health spas and physical fitness centers are doing big business of attracting people who want to exercise. Never has there been so much emphasis on staying active. Exercise and activity are very necessary for a healthy mind and body. They're holistic measures. Holistic means that it helps benefit the whole person. Physical activity improves functions of the entire body's systems. Some of the benefits of exercise and activity include an increase in muscle tone and strength, maintenance of body flexibility and coordination, improved respiratory function, prevention of pooling of fluid in the lungs, improved circulation, a strengthened immune system, and research suggests that a healthier immune system aids in our ability to fight off infection and other diseases. Benefits of exercise also include the maintenance of healthy skin. It promotes effective elimination, improves appetite and fluid intake, aids in the digestion of food, increases mental alertness, and also relieves stress. With this impressive short list, I will add, of benefits to being active, what might be some of the factors that are limiting the ability of patients to move? Lifestyle is one important factor. Some people just like to be more active than others do. Some engage in sports and other outdoor activities, while others prefer to read, watch TV, play board games, or participate in other activities that has more limited movement. Energy is another factor that influences our ability to move. Some people have low energy levels due to sleep disorders, disease, or possibly mental illnesses such as depression. Age is also a factor. It's no secret, I'm sure, to any one of you that as we age, we tend to slow down. The more strenuous sports like skateboarding, hockey, football get traded in for the more sedentary ones. Disabilities also influence our ability to move. Conditions such as cerebral palsy, muscular dystrophy, or other diseases that cause disabilities prevents the person from being as active as they would like to be. Fear also influences our ability to move. Many people, especially the elderly, are afraid that an increase in activity might cause them to fall. A fall for elderly people frequently means a fractured hip or other type of fracture. It's not at all uncommon to hear elderly people being admonished that maybe they better limit their activity to prevent falling. Pain is a very important factor in our ability to move. It limits our willingness to move. Diseases such as rheumatoid arthritis cause much joint and muscle pain with every single move, and as a result, people are reluctant to move as a result. Surgical patients with large incisions are reluctant to move because of the pain experienced when that happens. There are different types of immobility that I would like to talk about. The first one is called voluntary immobility. That type of immobility has always been something that's been difficult for me to accept. This is when people choose to be sedentary simply because they want to. My father comes to mind with this kind of immobility. He's an elderly gentleman who was capable or is capable of walking, but chooses not to, simply because he doesn't want to. He sits in his recliner chair watching television a great deal of the time. He enjoys going for rides in the car, but it's not something that he would choose to do if he was required to exercise and walk. He knows the importance of exercise activity. I and other health professionals have made it very clear to him some of the complications that can happen as a result of his immobility, but he continues to choose not to. This is something that I have had to come to terms with, to accept his choice to not engage in much physical activity. Another type of immobility is for purposeful or therapeutic reasons. Examples for limiting or restricting movement might be if the patient has a cast on their limb. Limited mobility would be to heal and repair the bone underneath. Limited mobility also might be ordered for a patient who has had a heart attack, allowing the heart muscle that has been damaged to repair itself. Patients with emphysema become very short of breath on any strenuous exertion. So they will be required to pace their activity and limit strenuous activity. Also, patients with various forms of arthritis also need to pace their activities to prevent joint damage and deformities. I'd like to have you know the difference between the terms bed rest and complete bed rest. There's a significant difference between those two terms. Bed rest means that the patient stays in bed for most of the time, but usually the term is accompanied with some limited mobility, such as the physician might order bed rest with commode privileges or bed rest with bathroom privileges. Complete bed rest, as the name implies, means exactly that, complete bed rest. If the physician has ordered complete bed rest for your patient, that means that that individual may not get out of bed for any reason. There's also unavoidable immobility. Situations when a patient is not able to move freely for various reasons. Some examples of unavoidable situations for immobility might be paralysis of some or all of the extremities due to nerve damage. Examples that come to mind might be someone who has had a stroke, an accident due to a diving or motorcycle accident, multiple sclerosis, or other disease that damages the nerves. Terms that refer to types of paralysis are paraplegia. Paraplegia means paralysis of the lower half of the body. Usually it includes the abdomen and legs. Quadriplegia is paralysis of all four extremities, both arms and both legs, whereas hemiplegia is paralysis of one side of the body. Could be either the left arm and leg that are paralyzed or the right arm and leg. Of all of the topics that will be discussed in this training program, this topic about complications of immobility, it ranks near the top of the list for importance. Whether a patient develops these problems has a lot to do with how serious we take the responsibility we have to prevent them. I will be reviewing the various problems as they occur by individual system. The first system that we'll be talking about is the system of the skin, or integumentary system. The skin serves as a protective function to the body. It helps keep microorganisms out and fluid in. Bed sores are by far the most common result of immobility. Bed sores are also called decubitus ulcers or pressure sores. There are four main causes of bed sores. The first is that pressure on the skin and bony parts of a skeleton can occur from lying too long in the same position in a bed or chair. The second main cause of a bed sore has to do with shearing force. Shearing force results from underlying layers of skin sliding against each other, much like I'm doing with my hands. This sliding against each other happens as patients slide down in the bed. The shearing causes blood vessels to break underneath the skin and damages the underlying layers of skin. A third cause of bed sores is friction. It happens when patients slide or rub against the linens. An example might be if a patient wants to scoot themselves up in bed, they will frequently dig in with their elbows and their heels in order to get higher up into the bed. The elbows and heels become reddened and painful and damaged and can result in breakdown of the skin if this continues. Moisture is another main cause of bed sores. Patients that are incontinent of urine and fecal material or stool tend to get bed sores because the moisture and caustic substances in the urine and stool cause the skin to macerate, which leads to breakdown of the skin. By now, I think you can pretty well guess those folks that are most at risk for the development of bed sores. Nurses use what are called either the Norton or Braden scale for the prediction of pressure sore risks. Some of these risks of patients are those that are immobile, elderly people who are frail particularly and have dry skin, thin patients who have only a little fat layer to cushion the skin, obese people because of the excess weight bearing down on the pressure points of their bodies, poorly nutritioned patients, those that are incontinent of urine and or stool, those that are unable to feel pain or pressure. A diabetic comes to mind. It's not at all uncommon that diabetic patients have loss of sensation, a numbness, in particular the legs and feet. If a person has shoes on that are too tight, bed sores can develop because they don't have the sensation to feel the pain experienced by the formation of the bed sore. Lastly, devices. Casts or traction can cause friction, pressure, and rubbing against the edges of the devices, and that makes them much more at risk for the development of a bed sore. What can you do to prevent bed sores from forming? The first and most important thing, of course, is to move your patients. Reposition them at least every 1 to 2 hours. Use pillows or wedges to keep bony parts from direct contact with each other. Use heel and elbow protectors to prevent the friction burns from occurring. Use a trapeze or other lifting device, such as a draw sheet, rather than using heels and elbows to be raised up in the bed. Monitor the bed elevation. Beds that are elevated at a right angle, 90 degrees, put an awful lot of added pressure on the patient's buttocks and should not be in that position for prolonged periods of time. High fowlers or bed in a 90-degree position should be reserved primarily for times when patients are eating. Use specialty mattresses or seat cushions that help reduce the pressure by distributing the body's weight. And lastly, keep skin clean and lubricated with a moisturizer. The musculoskeletal system is another system that is impacted by immobility. It's often easy to see complications that occur with this system. Muscles become smaller, the person becomes weaker and has less endurance. I'm sure you might have experienced being in bed for a day or two due to a bad cold or flu. Know how that feels the first time you get out of bed after a prolonged bed rest? Your joints might be more achy, you're a little bit lightheaded, you feel weaker than ordinarily. It doesn't take long for some of these complications to occur. Wasting away of the muscle can occur. This wasting away is called atrophy of the muscles. Brittle bones develop. Loss of calcium from the bones is called osteoporosis. This osteoporosis causes holes to be in the bone itself, much like a piece of Swiss cheese. Calcium loss begins as early as 2 to 3 days after the onset of immobility. This loss of calcium leaves bones much more likely to break. Another complication is stiff, achy joints, as we mentioned a little bit previously. Contractures can also occur. Contractures result from joints that have been allowed to remain in the same position for too long. The muscles stiffen and shorten, preventing the joint from full movement. The joint becomes fixed in a bent position. Contractures are permanent and can interfere a great deal with mobility and the person's independence in activities of daily living. Foot drop can also occur. In foot drop, the muscle in the calf of the leg tends to tighten, causing the toes to point downward. This causes foot extension and prevents bending or flexing of the foot. Even a brief length of time in bed is sufficient to cause a degree of foot drop that makes walking or application of shoes impossible to happen when the person does eventually get out of bed. Ways to prevent these complications are, again, make sure the person is as active as possible. Use footboards or pillows against the feet while the person is in bed to keep the legs in good alignment. Range of motion exercises are very important to help prevent these deformities. How to perform this range of motion exercise will be covered in detail in another videotape. Another system is the cardiovascular system. Limited mobility impacts the heart and blood vessels which make up this cardiovascular system. There is a change in our body's response when we go from a lying to a sitting position. Have you had the experience of jumping out of bed quickly and feeling suddenly lightheaded, dizzy, faint? Maybe you feel like there are stars in front of you. This happens more often in elderly as their cardiovascular system takes longer to adjust to changes in position. This is called orthostatic hypotension, and it's caused by a decrease in blood pressure that results from position changes caused by poor blood vessel tone. Moving patients from a lying to a sitting position needs to be done slowly, allowing the cardiovascular system to adjust to the change in position. If it's not done, the patient is at an increased risk for fainting, losing their balance, and falling out of bed. Immobility also increases the workload of the heart as more blood circulates to the heart in the lying position than when the patient is sitting or standing. This increased workload on the heart can cause congestion in the heart as well as heart damage. Immobility also decreases the flow of blood through blood vessels, particularly the blood vessels in the legs. This slowing of blood flow can cause blood clots. These blood clots are called thrombi. Because of the ever-increasing number of people who are traveling by air, health professionals are now advising travelers to move about in the cabin when possible because of the increased reports of blood clot development from pressure changes in the cabin, but more importantly, from the amount of prolonged sitting on long flights. Thrombi can break loose from the blood vessel and travel to other vital organs such as the heart, brain, or lungs, or other vital parts. This in turn can cause heart attack, stroke, or other potentially life-threatening development. The healthcare assistant can help prevent these problems by changing the patient's position slowly when they go from a lying to a sitting position. Dangle a patient prior to having them stand. Dangling involves having the patient sit at the edge of the bed before standing, giving their body time to adjust to the position change. Leg and foot exercises are also important ways to prevent these problems from occurring. It causes the muscles of the legs to expand and contract, moving the blood along to prevent pooling and blood clot formation. I'd like you now to watch leg and foot exercises as they are demonstrated. Adjust the bed to a comfortable working height. Raise the head of the bed to about 45 degrees, sometimes called semi-Fowler's position. Explain the purpose of leg and foot exercises to the patient. Lower the side rail on the side you will be working. Then fold the top linens to the foot of the bed, making certain that the patient is modestly covered. Have the patient rotate each ankle 3 times clockwise, followed by 3 times counterclockwise. Repeat 3 to 5 repetitions. Then have the patient rotate each leg, drawing imaginary circles in the air, 3 times clockwise, followed by 3 times counterclockwise. Caution, this exercise may not be appropriate following hip surgery, so be certain to check with the nurse before doing. Have the patient slide one leg up and then down while in bed. Do the same with the other leg. Repeat 3 to 5 times. Finally, have the patient curl their toes down, then up. Repeat 3 to 5 times. Encourage the patient to repeat these exercises every 1 to 2 hours while awake. Now draw the bedding up and raise the side rails. Lower the bed to its lowest position. Document that the exercises were done and be certain to report to the nurse if the patient experienced pain or discomfort during the exercises. The last measure that I'll be discussing to prevent cardiovascular complications is the application of elasticized stockings. These stockings are more commonly referred to as TED stockings. This measure does require a physician order, but when ordered can be extremely beneficial to the patient by providing support to the legs, and it also can help speed the flow of blood from the veins in the legs back to the heart again. Now I would like you to watch as application of these stockings is demonstrated. Obtain elasticized stockings as ordered by the physician. Accurate measurement for appropriate fit needs to be done prior to its application. Explain to the patient what you will be doing and the purpose of wearing these stockings. Always apply stockings with the patient lying rather than sitting. Adjust the bed to a comfortable working height and lower the side rail. Expose one leg at a time. Grasp the stocking with both hands at the top and roll towards the toe end. Remember that the raised seams should be on the outside, not next to the patient's skin. Slip the stocking over the patient's toes, positioning the opening at the base of the toes. Draw the stocking smoothly towards the thigh. Check to be sure that the stocking is applied evenly and smoothly. There should be no wrinkles. Check the material on the toes to be sure that it is not too tight. Repeat the procedure on the opposite leg. Stockings should be removed every 24 hours during the bath or as directed by a physician. Apply a clean pair of stockings and wash the soiled pair in mild soap and water. Check the stockings periodically during the shift for proper fit. Make sure that they remain wrinkle-free and do not become bunched, creating a tourniquet effect. Another system that is impacted by immobility is the respiratory system. This system includes the air passages and the lungs. If you recall, our lungs take in oxygen and we breathe out or give off carbon dioxide and other gases. Immobility from sitting or lying too long limits our lungs' ability to expand and contract effectively. Gas exchange is compromised and fluid rather than oxygen begins to occupy the air spaces in the lung. Secretions develop and that increases the possibility of lungs collapsing, pneumonia developing, or any other kind of serious respiratory problem. Measures that you and other healthcare assistants can take to help prevent this from occurring are, first of all, moving and repositioning the patient often so that fluid does not have a chance to stagnate in the lungs. Another is have patients perform breathing exercises. Deep breathing and coughing clears the air passages of this fluid as it might accumulate. Please watch as two different respiratory breathing exercises are demonstrated now. Assemble disposable gloves, a box of tissues, and an emesis basin. Elevate the head of the bed and assist the patient to assume a comfortable sitting position. This can be done with the patient sitting upright in a chair as well. Explain the purpose for performing these exercises. Ask the patient to take as deep a breath as possible and hold it for 3 to 5 seconds. Then exhale slowly through pursed lips. Repeat this maneuver a second time. Pass tissues to the patient and instruct her to take a third deep breath and cough forcefully, collecting any secretions that are brought up in the tissues. Put on disposable gloves to handle the tissues. Dispose of the tissues in an emesis basin. Assist the patient to assume a new, comfortable position. This exercise should be repeated every hour while awake. Report to the nurse how the patient tolerated the exercise and any unusual responses such as pain, dizziness, or throat and airway irritation. Another type of coughing and deep breathing is with use of an incentive or inspiration device. The purpose is to improve inhalation by moving a ball or cylinder up a chamber while inhaling deeply. Assemble disposable gloves, box of tissue, water pitcher, paper towel, and emesis basin. Elevate the head of the bed and assist the patient to a comfortable sitting position. Explain the purpose for doing the exercises and review the procedure with the patient. Put on your gloves. Set the device, called a spirometer, to the predetermined volume. If you have questions about that, check with the nurse. Have the patient hold the spirometer's mouthpiece with one hand and the spirometer with the other. Have the patient exhale normally and then place lips securely around the mouthpiece. Have the patient take in a slow, deep breath until the piston is elevated to the predetermined level. Have the patient hold her breath and count to 3. Make sure the ball on the right elevates and stays between the ends of the bracket to ensure proper inhalation. After a deep inspiration, have the patient remove the mouthpiece from the mouth and exhale normally. Have the patient rest for a moment, then repeat the exercise about 10 times. Repeat these steps hourly throughout waking hours. If at any time the patient begins to cough, encourage to remove secretions from the lungs. Offer tissues as needed. Rinse the mouthpiece with water. Label the unit with the patient's name and store in a clean area with easy accessibility. The overbed table works well. Assist the patient to assume a more comfortable position and tidy the area. The gastrointestinal system is another system that is impacted by immobility. This system includes the mouth, the esophagus, the stomach, and the intestines. Lack of mobility slows the movement of food and waste material. This can cause a person to have a loss in appetite, or it can add unneeded weight due to lack of exercise. It also can cause constipation and possibly a fecal impaction. A fecal impaction is a blockage of stool. This prevents the passage of further fecal material, resulting in abdominal pain and bloating. Measures that you, the healthcare assistant, can take to help prevent this are making sure the person is as active as possible and encouraging the patients to eat more foods that are high in fiber and roughage and low in fat. And also encourage the adequate intake of fluid. It's recommended that we drink between 8 and 10 glasses of water per day. That's not always advisable for patients that have medical conditions that may prevent that from being a good idea. So before you push that amount of fluid on your patient, be sure to check with the nurse. The urinary system is another system impacted. This system includes the urinary tubes, the kidneys, and the bladder. Lack of mobility causes urine to pool in the kidneys rather than drain by gravity down the tubes into the bladder. This stagnant pooling urine is a perfect harbor for infection and kidney stone formation. Ways to combat these problems are making certain that the person is as active as possible and encouraging the patients to drink adequate amounts of fluid. By doing so, they will be able to flush the bacteria and minerals such as calcium out of their system. The last system to be discussed is the neurological system. This system includes our mental functioning and our sense of well-being. Patients that are inactive become very stressful. It can lead to frustration and lowered self-esteem. Immobility impacts a person's thinking ability. It impacts their lifestyle and social and family responsibilities. It's also a source of depression and a sense of helplessness. In closing, the most important message to take away from this videotape today is the importance of patients staying as active as possible. You will care for many patients that are immobile or have problems with moving. Many of these patients are going to resist your efforts to move them due to pain, fear of falling, or other reason. You, however, have a very important role to help patients understand the importance of moving, even when it's uncomfortable to do so. The prevention measures that you take while caring for patients will help ensure that the complications from immobility will not occur. Thanks so much for your attention.